Someone once said, helping one person might not change the world, but it might change the world for that person. And that's why these employees, people just like you and me, share their stories selflessly and honestly. And it's why Wendy from the Cardiac Rehab Unit came to explain more about these stories after she saw Tony and many other workers from this site. Heart disease remains the leading cause of death in this country, but we all think it will never happen to me.
It's the country's #1 killer. More than 7,000 Australians dying from heart attack every year.
Heart disease kills one Australian every 12 minutes.
Good afternoon, my name's Colin Mulligan. I'm a member of the A shift alkathene plant. I'd heard about this Healthy Heart program and I've just been asked to come and just tell you my story, which happened approximately 7 years ago, and how it all come about. I just went for a walk after dinner with my daughter and suffered a bit of indigestion. Didn't think too much of it, went back home. Next night, exact same story, same scenario. And then no more, never happened again, so I didn't worry about it. And then it must have been about 2 months or so later, I had to go and see the doctor for unrelated diagnosis for maybe a cold or whatever it was. And while I was there, I said to him, Vincent's his name, and I said, listen mate, I had suffered indigestion the other night. He said, how long ago? I said, a couple of months ago. He said, what are you telling me for? And I said, well, I don't suffer indigestion. Oh. So he got me up on the bed and we'd done an ECG. And because he's been my family doctor for 30 years, he checked out the last time I had an ECG, which was probably 10 years prior to that. And he said, there's no difference, Colin, it's exactly the same. But he said, at that age, we'll go up and see the cardiologist. So I went up there, told him my story. He said, have you had any symptoms or pain? I said, well, mate, I just shoveled about 3 or 4 tonne of dirt there a week or so ago. And he said, how'd you feel? I said, well, probably the same as you'd feel, a bit puffed. He said, look, okay, what we'll do, we'll send you down for a CT scan. And that's when we found out I had an elevated calcium level, which I had no idea what it meant. And he said, we're going to have to do an angiogram now. So off to hospital we go. He starts doing the angiogram. He told me whatever he finds, he'll just do some stints and everything will be happy. But halfway through that, he said, no, the arteries are too far blocked, so we're going to have to do bypass surgery. So they kept me in hospital. And then the very next day, we went in for a triple bypass. It was actually on my 59th birthday. I was very, very fortunate. I had not had a heart attack, but I was probably going to be one of these people who just drops down dead, because I had arteries blocked at 90% and one at 99%. Yeah, so from that day to now, I have to go and see my cardiologist. I see him once a year. And we've agreed that I just do a stress test with an ultrasound and make sure everything's good and make the medication's fine. So the big thing I found out of this is your doctor, he knows all the parts of your body, but you're the only one who really knows your own body. So in my case, I was probably a bit slow to take up on it, but what I know now, if you've got anything different that's happening in your body that you normally don't suffer from, go and speak to somebody.
Hi, my name is Sebastian. I'm an operator at ICSOM at Botany Plant on the chlorine site. About 2.5 years ago, I was doing a major renovation at my place, feeling a little bit tired and thought I'd call an early day. went back to where I was staying, and a mate of mine said, "What are you doing at home?" And I said, "Oh, I just felt tired." So he said, "You should go down to the doctors because you're not a person to complain about feeling tired." So I made my way down to the doctor. The doctor looked at me and laughed and said the same thing. I just suggested do a blood test to see in case I've had any symptoms or signs of heart attacks. He said, "Did you feel any pain or uncomfort or anything?" I said, "No, feeling fine." So go down, do a blood test, and he said, "I'll give you a call back the next day just to see how your blood test results were." Within a couple of hours he called me and he said, "You should make your way to the hospital because you've had signs of a heart attack." So I've made my way to the hospital, and then a couple of days later went in for heart surgery. Had a quadruple heart bypass. Just feeling normal the day before, and then it's felt so unreal the next day that you feel like you had something wrong with yourself and you couldn't even diagnose it yourself. So one of the major important things is you eat healthy, you don't abuse yourself, but should always keep regular checks. Finding out late after all of that heart attacks do run in the family, so it's a thing that should always be checked. You should not take advantage of your results, so you should always get a double check. That's something that should always be done.
Morning, Wendy.
Hi, Tony.
How are you?
Good, thanks. Tony, thank you for sharing your story with us.
Pleasure.
First question is, why did you have your heart check in the first place?
That's a really good question. I didn't intend to have a heart check. So the story starts, I was mowing the lawn, and twice in 2 weeks I just felt a little bit weak across the top of the shoulders. It was a very, very strange, and it's a feeling I can't explain to anyone. But I thought, having a doctor's background, that I thought it was blood pressure. In other words, I don't know what I'm talking about. So I did go and see the doctor and said that I've been on blood pressure tablets for some time. I was starting to lose weight, and I thought that the blood pressure was getting low when I was exercising. So we had a bit of a conversation. She looked at my cholesterol, which was normal, looked at my lifestyle, which was really out of control. Like I said, I was losing weight, and then she started asking me about my family history. Mm-hmm. And my family history is, I had an uncle die at 42, I had a mother who had a heart attack at 57, I had a brother who had a heart attack at 57, I'm 62, and I thought I'd dodged the bullet I thought my heart was fine. And simply because of that family history, the good doctor sent me for a stress test. The stress test showed that I had a problem. And so that's the story about getting to where I am now.
Okay, so then you went on and had an angiogram.
Yeah, the stress test showed that part of my heart wasn't working as it should, and the doctor reassured me that you're going to have an angiogram, and that if there is a problem, that he would put a stent in. So, funny enough, I went to the doctor's on the Tuesday. The following Wednesday I went for the stress test. The doctor changed his appointments around so I could have the angiogram first thing Friday morning. Came out of the angiogram, and his comment to me was, "Mr. Clapham, you're a very complicated man. I spoke to all my colleagues about what we should do. You've got multiple blockages in difficult positions, and so we thought about bypass operations, we thought about multiple stents. We decided the best way forward is for you to go in next Friday and have multiple stents." So it went Tuesday, following Wednesday, following Friday, following Friday. Following Friday I went in and had 3 stents put in.
Was this a surprise to you? Did you, if you'd place the odds on having heart disease?
That's a really good question, because I guess some extent, because of family history and because of what I just explained about my mother and brother, I was not surprised, but I was shocked. I think it's always a shock. Like I said, I thought I dodged that bullet. So, yeah, surprised but not shocked, or shocked but not surprised. One of the two.
But that's the nature of the beast, isn't it? You know, whether you've got heart disease and they manage that with stenting, or whether they manage it with bypass surgery, it's the same disease at the end of the day.
Absolutely. I mean, I think I was just lucky. I was lucky in a lot of ways that that I had good doctors who followed up, which is, I think that's a really important message to get across, is that if there is something going on and the doctors don't recognise it, you've got to keep pushing. I was lucky I didn't have to do that. But end of the day, you need to get that follow-up. You need not just your GP, you need referrals to your cardiologist, and the cardiologists need to push through and actually do everything they need to do.
Okay. Thank you.
All right.
Thank you for having me. Is he? Is that typical?
Yes,
I've been working in cardiac rehab for a few years, probably around 12, 13 years now, and I think over that time I think Tony was the 6th person from his company that's been through the program that I know of.
Tony Clapham.
Yeah. So what's going on here?
Yeah, that's why we're...
Okay, so I've made it a bit blokey actually, so I didn't realise there were going to be ladies here, so sorry ladies. Okay. So your engine, the heart, it's a muscular pump. There are some other structures in it as well. It has 4 valves throughout the heart. It has its own inbuilt generator, the sinus node, and it has its own electrical circuitry as well. And of course the plumbing. The plumbing is what we're going to focus on today. Just like your engine, it needs regular servicing and maintenance. You need to look at the faults and the warning lights and get those investigated. You need to be particular in the fuel you use, and it needs regular running. This afternoon I'd like to talk about some heart issues, mainly what is coronary artery disease. I'm going to first look at the subtle signs, or the silent signs, that our heart gives us. Look at the emergency signs, what diagnosis is going to mean, and the management of these issues. The heart. The heart is about the size of a clenched fish, so it's not a big organ at all. The coronary arteries run over the surface of the heart. Makes them ideal to get at when it comes to surgery. If your heart's only this big, those coronary arteries are not very large. So we would measure those in millimetres, and a good sized coronary artery would probably be about 4 millimetres. So when we talk about coronary artery disease and the sludging up of these arteries, it doesn't take a lot of plaque. Basically there's 3 coronary arteries. There's the right coronary artery coming down the right side of the heart, and this side tapering underneath. You've got the LAD coming down the ridge of the heart, finishing at the apex, and the third branch is a circumflex wrapping around the left side of the heart towards the back. Where was your blockage?
It was the left anterior, I think.
Okay, that's a significant artery. So coronary artery disease, or we give it a loose term, heart disease, means blocking of the coronary arteries of these arteries. It's a slow process, and depending on your family history, what risk factors you have, what other medical conditions you have, as to how rapidly that progresses. Heart disease begins very early in life, and autopsies of people in their 20s shows the beginning of coronary artery disease. So I saw a chap this week on Tuesday, and his health in the last 10 years has been perfect, but when he was in his 30s he weighed 110 kilos, and we think that's when the artery really started to sludge up. The symptoms the heart gives off can be silent or very subtle and not obvious in a lot of the cases. And then of course you have your emergency symptoms, which I'll cover. So this is the early stages. The plaque starts to form in the inner lining of the arteries, and people can walk around with quite badly blocked arteries and have no symptoms at all. Some of the subtle signs, comparing it back to an engine that only idles in the garage, there may be no indications of a fuel flow restriction at all. In other words, if you're a couch potato, you can have severely blocked arteries and have no symptoms at all. The signs you get are more common with physical activity and exercise. That's when most people pick it up. When we have people coming in and having procedures done on their heart, they've often had some early warning signs that they just haven't realised come from the heart. So that's what today's about as well. And often we have an explanation for our symptoms and we dismiss them once we've found an excuse for them. So it might be indigestion, for instance, that might be your symptom, but you've just been out and had a big takeaway meal that night and you can dismiss it as that. Or Richard and I were talking earlier, sometimes you might feel tired and you might just put that down as getting older. Okay, so you don't just suddenly get tired. It creeps up slowly, like age does, and we dismiss a lot of our symptoms due to age. Okay, some of the subtle signs, it might be a racing heartbeat, you might be having palpitations, or you might notice that you've got an irregular pulse. And I'd encourage you all to know how you feel your pulse, the radial here, and notice that it's regular. If it's irregular, please seek medical attention. That can be quite dangerous. You might be becoming more puffy, you might get puffy ankles, you might start retaining fluid. That font's very small, isn't it? You might have sudden weight gain or fluid gain, especially around the gut area, and you might lose your appetite, get some bloating. But another symptom is you might find at night you're not sleeping well, you're not breathing well, you need an extra pillow to sleep with. That's another big sign. You might become wheezy with your breathing, you might develop a tickly cough. Tiredness or low energy, that's a common one. Dizziness with physical activity. I've heard people tell me their legs become heavy. Different sensations in the arms is another one I hear frequently. It could be tingling. I had one chap tingling in 2 fingers when he mowed the lawns, and he ended up with 2 stents. So any of these symptoms that you get with physical activity and they go away, they're going to be suspicious. Indigestion. If you suddenly get indigestion, you've never had indigestion before, that can be a warning sign. Erectile dysfunction, that's a warning sign as well. So vascular disease does not just happen in the heart, it happens throughout the whole body. So erectile dysfunction is certainly one of those things. If you have those symptoms, I would encourage you to go and have a chat with your GP. If you've got some suspicious signs, you might do an ECG, he might send off some blood tests. He should, or she should, take particular interest in your family history. And with family history, we're interested in first-degree relatives, so your parents and your siblings and sometimes your children. If they've had their coronary artery blockages diagnosed, male under the age of 55, female under the age of 60, that's significant family history. I'm not worried about your grandmother at the age of 75, that kind of thing. They should also talk to you about other risk factors, especially if you're a smoker. That's a red light. If you're obese, you're inactive, and other medical conditions make you a little bit more likely to develop heart disease as well, in particular diabetes. I encourage you all to know what your numbers are in terms of blood pressure, cholesterol, and your diabetes status. Amanda, you have a lot of that done here, don't you, which I think is fantastic. If identified early, we can prevent heart attacks. If your GP sends you off for a cardiologist check, he's going to probably put you on the treadmill, do an exercise stress test. That's where they wire you up and look at the electrical activity. You're nodding, you've had one done. and see if they can get some changes on your ECG. Probably the most reliable non-invasive check is what we call the stress echo, where the cardiologist will put you on the treadmill. First of all, he'll do an ultrasound on your heart at rest, looking at how that's functioning. Put you on the treadmill, get your heart working really hard, and then do a quick echo. And if there's one wall that's just not keeping up with the other wall, we know the artery feeding that territory, there's an issue there. And if he's suspicious, he will send you off for an angiogram. If he's got some doubts, he might send you for a CT angiogram. Has anyone in the room had an angiogram done?
I had a CT one.
You had the CT angiogram first?
I went in for the other one first and ended up having the CT angiogram.
Okay, yep. So a CT angiogram is a non-invasive procedure. They put you through a CT scanner. If something shows up on CT angiogram, you will need to go and have a formal angiogram done. So an angiogram is gold standard. The only way of being 100% sure of what's happening in those arteries. So Richard, Colin's not here, it's all up to you.
Yep.
What were your symptoms?
So I didn't get a real lot. I had some funny blood results, but that was probably it. In hindsight, I can see that there was probably a loss of physical function and things like that, breathlessness. But having had the stent, it comes back pretty quick.
So you found that you're less tired now?
Yeah.
You've got more stamina?
Yeah. And quicker recovery playing sport, stuff like that. So you can run further. And
So now that you know the symptoms leading up to that, they came on slowly. Yeah, that's why it's an insidious issue. It's so slow.
Did you have much family history?
Yeah.
You did? Okay.
So at my age, my father's had quadruple bypass.
Yeah.
And stuff like that. And my grandfather died at 65 from heart complications.
So when you said blood tests, cholesterol levels? Or?
I was more of a liver function test, so I was on blood pressure medication, so they want to do liver function and cholesterol and stuff, and there was an additional test she asked for, which is the CK, which is to do with your liver metabolising used body muscle. So you do exercise, you use your muscle, and then your body's got to get rid of that byproduct. And that was very high, so she was concerned at that stage. I did have some shoulder pain, but later on the cardiologist said it probably wasn't that, it was probably like anxiety or stress or something. So I didn't really get any obvious, but in hindsight you can see how I was slowing up and less physically capable.
Well, the big difference is you've noticed the difference straight away, don't you?
Yeah.
When you come around after the surgery, suddenly you've got more energy.
Yeah, yeah.
I mean, I had an electrical problem in my heart, and that was another thing. It was the first time operation I'd ever come around from feeling fantastic.
Yeah. If you've had coronary artery disease for some time, say roll forward 12 months, Richard, and you've been doing less and less because you couldn't, you become then physically deconditioned, so you don't get that same quick response either, which does disappoint some people we see. Yeah. Okay, so family history with your dad, I think that was a red light to your GP. So fantastic.
My brother's had stents as well. He's 11 years older.
And have you got brothers and sisters? Have they been checked?
Yeah, just my brother.
Just
my
your
sister's
brother?
been checked, but she's clear. So.
Yeah, yeah. And that's something else to think of. Often the girls get forgotten. And we know just as many women have heart disease and heart attacks as men these days because of the sophistication of our testing.
Yeah, she had to test early this week, so she's good.
There are many assumptions out there, and we hear things like, but he's fit and not overweight. You can still have heart disease. He was the last person I thought this would happen to. It can't happen to me. I don't smoke and I don't eat takeaways. I'd love $1 for every time I've heard that. I just had a checkup with my GP or my cardiologist, and they've given me a clean bill of health. When we talk about heart attacks, they can happen to anyone at any time, irrespective of the checkup you've just had done. There's no guarantees. Like I said, it can happen to anybody. And when it does, it's often recognised it's not taken seriously. There's lots of emotions involved, and it's a shock to your family, to your friends, and to your colleagues. Okay, let's look at the serious signs, the signs we consider an emergency. The actions people take often depend on where they are at the time. So in a work setting like this, you'll find that your colleagues will often call the ambulance or get you to see common sense and get help. If you're home with your partner, the wives often call the ambulance. If the wife has the problem, she probably will wait for a husband to wake up and tell him to call an ambulance in the morning. It's just the way we think. People that are home alone are least likely of all to call an ambulance. In cardiology, we have a phrase called time is muscle. So the longer you leave that artery blocked, the more likely you are to have irreversible permanent muscle damage. And of course, it's an emergency, we'd like you to call an ambulance. And these are symptoms of a heart attack. It's not always pain. It could be pressure, heaviness, tightness. It could be in the chest, it could be in the neck, it could be in the jaw, it could be either arm. There's some misinformation out there about it must be the left arm. It could be either arm, or it could be part of the arm. It could be in the back, it could be in an A shoulder or both shoulders. And with that you might also feel nauseous, become sweaty, dizzy or short of breath. So if you get any of those symptoms whilst exercising, or when you stop they go away, they are warning signs. If you get these symptoms and they last for more than 10 minutes, that's an emergency.
Can I just ask a question before you go on? So, any reason why legs weren't up? Were legs up there?
No.
Is there any reason why legs weren't there?
So what happens is, what I understand to happen is, you get a blockage in your heart. It's not the heart that's usually giving you the pain, it's the associated nerve. So depending on which part of the heart you've got your problem in, depends on where you get the pain. So when they put my stents in, they actually physically block that blood flow for like 30 seconds or something like that. And that's how I think I know what angina is like, but only because of that. If they hadn't done that, I would. And then you get a bit of irritation in that area for the next couple of days or weeks while the stents bed in.
So to answer your question, if I can add to Richard's reply, pretty good Richard, there's no direct nerve supply from the heart to the brain. So the heart gives its signals via other nerve pathways situated in the chest. So hence indigestion, back pain, shoulder pain, jaw pain, that kind of thing. So this is the Heart Foundation Action Plan, and you'll see if you get those symptoms, stop and tell somebody how you feel. If the symptoms haven't gone within 10 minutes, it's call an ambulance. The Heart Foundation just this year has started recommending that whilst waiting for the ambulance, you chew on 300 milligrams of aspirin. That's an antiplatelet that might just stop the blood clot forming, completely blocking that artery. So if you've got mini aspirin at home, they're 100 milligrams. We'd like you to chew on 3 of those because they're often coated. We want you to break down that coating so it acts straight away. And why do we want you to call an ambulance? They have a system now, an ECG is taken at your home, and that's now downloaded to the cardiologist on call. The cardiologist on call can say, yes, this is a heart attack, get them in straight away, and if it's after hours, we'll have the angiogram lab at Sutherland Hospital open, ready to go 24/7. So it's an emergency. So we have that facility rather than coming via emergency department, going through all the checks. You're rushed straight through to the heart clinic. They can start monitoring straight away. One of the dangers with a heart attack is if you have a blocked artery and this tissue starts to die, it becomes electrically unstable and can throw off an electrical storm. Okay, that's like the code blue on telly with the paddles. That's what you need to get somebody out of an electrical storm, is a defibrillator. And they can start drugs, necessary drugs as well. To diagnose a heart attack, we're very interested in your symptoms that led up to this. We're going to do an ECG as soon as you hit emergency, and we're going to check your troponin levels. Richard, what's a troponin level?
That's the muscle breakdown stuff, isn't it?
Yep.
So if you have damage, like any muscle, you'll produce this stuff. But if you have a heart attack, you'll see those chemicals in the blood.
Okay. So your markers would have been something like CK from the liver. Yeah. Okay. And that's all we had years ago to measure heart attacks, and that's when they said no, women don't have heart attacks until we could measure troponin. It's a cardiac specific enzyme. It's in all the heart cells of the heart muscle. When they're damaged, the troponin leaks out and gets picked up in a blood test probably half an hour to an hour later. Very specific. If you have troponin in your bloodstream, you've done some heart muscle damage. Now, depending on what we get from these three lots of symptoms as to what action will be. So if you've got a troponin rise or even just an ECG change, you will be rushed up to have an angiogram. They're going to give you a loading dose of aspirin. They're going to put you on a monitor, give you pain relief. And then after the angiogram, you'll stay in coronary care for 24 hours afterwards, a minimum of 24 hours, because we are monitoring for that electrical storm. Heart attacks differ, and if I'm talking to a group of, say, 25, 30 people in a group, I'll go around the room and ask their symptoms, and I might have 3 people with the same symptoms in the room. They vary that much, and that's why it's so easy to miss. Some people have a heart attack, a silent heart attack, have no symptoms at all, and they might go to maybe have a pre-op checkup for maybe a joint replacement or surgery, and they do an ECG, and they find if you've done permanent muscle damage, you'll have a change on your ECG that stays there forever. And the bulk of people that have silent heart attacks are diabetics. And I would say from the national average, we've got at least 2 diabetics in the room here now. And if you're a diabetic, you may not get the symptoms. I just advise you to take particular notice of getting more shorter breath doing physical activity. That's usually the most common warning sign for diabetics. There's also no correlation between the intensity of symptoms that people have. So someone can come in with a major heart attack and have only very slight symptoms. Other people can come in with severe chest pain, for instance, and have hardly any muscle damage. So there's no correlation there. As I mentioned earlier, time is muscle. And we also have a policy of a door-to-balloon time of under 90 minutes. And that means the minute you hit the hospital doors, we're going to have that artery open within 90 minutes. Okay, so we don't want you hanging around at home waiting for, someone to come home from work or whatever, or your GP to be on duty. We want you in ASAP. So a heart attack is generally caused, the majority of the time, by a blood clot. And as I mentioned, these arteries, we measure them in millimetres. That blood clot only needs to be the size of 1 or 2 pinheads to totally block your coronary artery. So you can see up here, oops, geez, you can see the plaque here. That plaque, it ruptures, so like a pimple, that ruptures, and then a blood clot seals it off. So all the platelets or the blood clotting cells going across that face will all start to bunch up and clump together, and next thing the artery's totally blocked. So people might get symptoms when that's not totally occluded. They come into casualty and we'll do the troponins, we'll do the ECG, and they will both look normal because as yet there's no heart muscle damage. We might say to them, go home, if the symptoms come back again, come back in and we'll retest you. And this is where you hear in the media, Joe Bloggs presented at whatever hospital, they sent him home, he had a heart attack and died. Because if that continues to block off, your symptoms will come back. You need to come back into hospital because this is an emergency. And this is why we want you to chew on the aspirin as well, because that may just let a trickle of blood get through, prolonging the time you have to act. So it's plaque rupture. So you don't have to have a significant amount of plaque in there to rupture. And that's what I mentioned before. Anybody can have a heart attack. The plaque just ruptures, blood clot forms, Doesn't matter how old you are. And this is the picture I was going to show you. So where the blood clot forms, there's no blood flow beyond that, and the muscle starts to die. But during an angiogram, a catheter is fed through the aorta, or if it comes through the radial artery, it comes down one of the arms into here. They engage the catheter tip at the very beginning of the coronary artery, and they will push dye through there. And they'll take that out, they'll put one in for the left side, put the dye down, and that's what you would see. It looks like the artery is being crimped. In fact, that's plaque inhibiting blood flow through that point. And after a stent, you can see how that artery is nicely opened. So you can see someone getting tired. It's going to happen slowly, but in an emergency, it happens quickly. So what do we do once we find you've got an occlusion of your coronary artery? They might start you on medicines only, they might put some stents in, or they might do bypass surgery. The important point to note here is the disease process is just the same. It's just the same, whether you have bypass or stents. And I do see people given the choice of stents or bypass. And of course, the majority of people are going to say, I'll have stents, thanks, I don't want to be opened up. But if you have what we call triple vessel disease, and that's a blockage across all of those three arteries, generally you're sent off to see a surgeon. So let's look at stents. With a stent procedure, they will put a balloon in and pass that through the blockage and inflate that balloon. And Richard, that's when you said you got the pain. So the first thing they do is inflate the balloon, and they hold it there at some pressure, and it might be up to 24, 28 atmospheres of pressure. And whilst that balloon's inflated, as Richard said, there's no blood flow beyond that point, and you might experience the chest pain or the pain that brought you into hospital. And if that's mimicking the pain you came in with, bingo, they know they're in the right artery.
So you're not knocked out then? You're actually awake by the time.
I feel really nice. I was lying down and I was feeling, they just left me in this dark room for about 5 minutes by myself, and I was feeling a bit anxious. But they give you a happy drug.
Yeah.
And I was still feeling a little anxious, so they gave me a top up. And after that, I was fine. I was chatting away to the cardio surgeon and everything. It was great. You're watching all the pictures and all that sort of stuff, they're rerunning bits and all that sort of stuff.
You do need to be awake, because at times they're going to get you to take a deep breath or hold your breath to get a good picture. So you do need to be reasonably awake. If it's a procedure that's going to take a little force or be a little bit tricky, they might give you more happy juice. Yeah. The aim of the balloon is to ensure that lumen is nice and smooth all the way along. You don't have any bumps in it. And then after that, they will put another balloon in it. This time the balloon's got the stent wrapped around it. They inflate that balloon and they wedge that stent into the artery, holding that open. You can see that bottom corner there. And this is what a stent looks like. It's quite tiny. Like I said, 2 to 4 millimetres. And the length varies as well depending on your arteries and where they're going, and is it near a bifurcation or whatever. There's a little stent here. Richard, would you like to show that around? Thanks. Just amazing technology. And for you engineers in the room, that's actually made from one piece of metal.
It will last your lifetime. It will last your lifetime.
You've just got to look after your arteries, and it's there forever. The membrane lining the artery will actually grow over and cover that stent over time, so it becomes part of the artery. Now, because the artery's tapered down, once that's wedged in the artery, it's not going anywhere. But until that membrane's regrown and covered that stent, we put you on a particular anticoagulant, a very potent anticoagulant. Richard, bypass surgery. So this is very elaborate plumbing. And any spare parts they take, they sew onto the base of the aorta. Just here and then below the blockage. So that blockage is not taken away, it stays there. So this would be a piece they take out of the leg. What they're also using these days are the mammary arteries, where that's cut off and then directed straight onto the heart. So that's a normal artery with only one end. stents started almost 30 years ago, and now they can put a catheter down through here and actually balloon some of these blockages once these might block up. So, and they can actually balloon inside these if they need to. So the technology around stenting is unbelievable. Yeah. Spare parts, we take those from the forearm, so it could be the radial artery. We can take it from the leg, the saphenous vein, and I see people coming in and they may have a cut from their groin down to their ankle, and the heart's only this big, and you wonder, well, why do they need this much tubing? They need to match up the sizing and the valves and everything to get it right. But the mammary arteries, great long-term life out of those. So whilst heart disease is progressive, it is manageable. And the medications we have everyone on as best practice internationally for anyone with blockages that need stents or bypass, or we know they've got significant blockages, are an aspirin and a statin or a cholesterol medication for life. Richard, is that right with you?
Yeah. Yes,
good.
yeah.
And what statin are you on?
Crestor.
Crestor, rovastatin? Okay. Yeah. So there's a lot of negative publicity out there around cholesterol medication. In this situation, you're on it for life. Best practice. It's one of the factors that stabilises plaque, so you're less likely to have a heart attack. Okay. And the aspirin's there, so if you do rupture some plaque, the aspirin's going to prevent the clots forming and a heart attack as easily as well. Cardio. Yep. We'd be encouraging you to have your regular cardiologist checks, regular blood tests looking at your cholesterol and your glucose numbers and making sure you're hitting target with those. It's a good conversation to have with your cardiologist is where do you want my cholesterol numbers to sit at? Because as we go through life, our cholesterol numbers change. So for those of you in the room that are under the age of 45, once you get to 45, these numbers start to change, your cholesterol and your blood pressure. So that's a good time to have your over 45s check, which the government pays for. Know what your normal blood pressure is, and you can go into most local pharmacies and have your blood pressure checked. Lifestyle factors, please don't smoke. If I see an angiogram on someone who's been a smoker for a reasonable amount of time, you see a splattering of disease across all of these arteries. Be active, and being sedentary these days is something we're really looking at. And when you look at the lifestyle of young children today, a lot of people are sitting behind a desk. That's just going to be clogging up arteries for sure. And of course, being conscious of your diet. Act on any early signs you have. We want to prevent an emergency. Amanda, how many AEDs do you have around?
Every control room has one, and the site safety team, who are here 24 hours, have 2 in their trucks, and they can go anywhere to respond.
Mm-hmm. And does everyone have training on how to use these?
All the first aiders do, and of course I do, and the site safety team, who are all occupational first aiders.
We're seeing a lot more people surviving out of hospital cardiac arrests these days because of these devices. If any of you are from Caringbah, we had a chap brought in from the Caringbah YMCA. He'd been up there exercising, and they grabbed their AED and they shocked him a couple of times. Great successful outcome. Okay, so these are saving lives. Richard and Sebastian's not here, so I guess it's you. What things helped you in your recovery?
My family support was good. Caring and supportive mates.
Mm-hmm. Work colleagues?
Oh, of course.
Yeah. Okay, was there anything that you wish you were told or weren't told at the time? I know you got onto Professor Google a little bit.
Yeah. Well, no, my GP was very good. I think she saved my life. So between friends and family, that was pretty much it. I have a friend who's a psychiatrist. She was really on my case about doing too much and all that.
Mm-hmm. And did it affect you psychologically?
Yeah, it is almost like a near-death experience.
Yep.
And the cardiac surgeon said that I'd had a widowmaker, and if I hadn't had the stent, well...
Did you have the widowmaker?
Yeah, I had the widowmaker. The other cardiologists seemed to think it was a bit of a grandstand.
Okay. Okay. So the widowmaker is on the left side. It's just a very small portion of the left. So it's the left main, we call it, and then it bifurcates into two arteries that feed this left side. If you get a blockage in there, the total left side of your heart dies, and that's not compatible with life. I can tell you that now afterwards. Okay. Yeah. I think it's very easy to underestimate the psychological impact any heart issues have with people. How were you with your heart issue? Did it affect you psychologically?
I was just amazing, the total difference in life.
Yeah, yeah. So it was a positive experience for you?
It was.
Yeah.
It was pretty scary on the day I had it done because I went to the heart clinic and while I was waiting outside, they operated on someone who had a heart attack and they all jumped on there and I'm sitting there going, oh shit, I'm going in next.
Yeah,
and,
yeah. So no, you've got to wait if there's an emergency coming in.
Yeah.
And if you're on the table having an angiogram, they will just put a lock on that, take you out, and the emergency takes over.
Yeah, well, so I had to wait for that, but it was pretty scary.
Yeah, we get pretty excited about that kind of stuff.
Yeah. Yeah. And then when I went in, because I was having the electrical blasting done.
On ablation?
Yeah. They stuck this huge thing on the back of my thigh about this big and it was freezing cold. And I said, what's that? And they said, oh, that's to conduct the electricity that we're putting into you away. And that was connected onto something. So,
okay.
Yeah.
Okay. Sorry, what's your name?
Debbie.
So Debbie's problem is an electrical problem. And you've had a pacemaker put in. Was that?
No, I just had the
ablation. Okay, right.
I had SVT.
Oh, right. Okay. So the hot spots that are firing off those extra beats, they've gone and they've burnt those off. Yeah. That's making a big difference to a lot of lives. Ablation.
Yeah. So it was. Apparently, I was quite concerned during the operation. I don't remember it because the doctor said to me the next day, "Well, you were really worried." And I said, "Yeah, well, I've been hearing this other one and." Yeah. They kept saying, you kept saying, what are you doing? Why are you doing this?
They do like to put you to sleep for that procedure, unlike Richard's procedure. Yeah.
Is that quite common for people who are, my dad had a heart attack when he was in his late 50s and he led a pretty poor lifestyle. So that probably contributed heavily.
Absolutely.
But he didn't have, he was very carefree, never really stressed out about anything. But after he had his heart attack, he got really severe depression and all sorts of stuff.
Yeah.
Right, it lasted for years.
Yeah.
That had to be controlled by medication.
Yeah.
He was, he was never one to don't need to go to the doctor, all that sort of stuff. Never worried really about anything. Is that common for people who have heart attacks to have sort of struggled sort of mentally?
Absolutely. Probably 30% of people will have depression that 12 months following. And the odds for depression in Australia are pretty high anyway, 1 in 5. Well, with cardiac issues, it's much higher than that. So anyone coming to a cardiac rehab program with us, we screen everybody for depression and anxiety. It's that big a factor. And when you're recovering from something like this, you need to recover physically and you need to recover emotionally. And they need to be in sync with each other. Otherwise, it just doesn't work. So a good GP should be keeping a close eye out for anyone who's had a heart issue, looking for depression. Yeah. Have you been checked yourself? Not for depression, but for heart disease.
No, but I don't smoke.
Or eat
6 cans of beer every day.
I think I had a slide up there with that written on it.
I haven't got my own business.
You'll have to add, don't be like Craig.
Yeah.
And I exercise and never did, so I reckon I'm so.
I think there's going to be a lot of eyes on you. Richard, any final words of advice?
Definitely get it done. Definitely make changes in your life and get it sorted. You don't know what's sneaking up behind you. Even a few people say to me that I could have just popped over playing soccer or anything. You just don't know.
Okay, so in summary, we want you to run your engine in 5th gear regularly. That means getting out and going for a good walk. We don't want you smoking. We'd like you to act on your symptoms early and have your over 45s heart check. That's a preventative measure. Know your numbers, okay? Know your blood pressure, know your sugar levels, know what your cholesterol is, blood pressure. Regular cardiologist checks if you do have a pre-existing heart issue, and your medications are extremely important. We know that within 9 months of discharge from hospital after a heart attack, about 50% of people take themselves off their medications, and the medications are such a vital part in prevention going forward. Yeah. Okay, I've got some big thank yous. First of all to Qenos for making this possible, to Amanda, and to Tony and the boys. Tony was an instigator in all of this happening, and he really wanted his story heard. And to my hospital letting me have time to come down here and speak to you all. So thank you.
Thank you. Thank you. Thank you. Thank you. Thank you. Thank you.